Hi, I'm Kim Webster. I'm a speech-language pathologist with many years of experience working with people affected by head and neck cancer. Today, I'm here to talk to you about how speech-language pathologists may be involved in the care of people with head and neck cancer. It's really important for patients diagnosed with head and neck cancer to have a speech-language pathologist as part of their multidisciplinary care team. We are there to ensure that their speech and swallowing function stays as good as possible and to make sure that they understand any potential effects, direct or indirect, on their voice or their speech or their swallowing. People with head and neck cancer may be affected in a number of ways with communication or swallowing. Some people are affected by the presence of the tumor, and then more commonly, people are affected with the treatments, either surgery, chemotherapy, radiation, or combinations. They may have trouble with their voice, their speech or articulation, and their swallowing. And speech-language pathologists can help with any of those. Patients with head and neck cancer can have a variety of needs, and it depends on the size of the tumor, the location of the tumor. Some of my patients have tumors of the tongue or the oral cavity. Others have tumors of the vocal cords or the pharynx or throat. And if it's a small tumor and the treatment is going to be minimal, then the needs are less. But for larger tumors, such as those that would involve a total laryngectomy or a removal of the entire voice box, the needs are great and the fears are great, and the emotional overlay is also big. So it just depends on the patient and the location of the tumor and the type of treatment. Patients living with head and neck cancer have a lot of emotional needs, and I think we see it a lot in my field because we work with speech and swallowing, and those are important for daily life. And so people are afraid. They're afraid they might not be able to speak or communicate with their loved ones. They're afraid they may not eat or swallow again. And there's a lot of emotion tied into your voice. So it's an important part of what I do to talk about the emotional needs and to address that. Speech pathologists play a role in the lives of people with head and neck cancer before, during, and after their diagnosis and treatment. Ideally, we meet with patients before their treatment so that we can give them an idea of how their speech or swallowing might be affected by surgery or radiation or chemotherapy. And then we also meet with them during to see if there are any things we can help with, or to practice exercises that might prevent them from getting swallowing problems. And we also meet with patients after as needed to help with speech and swallowing problems. When I meet with a person who was just diagnosed with head and neck cancer, they may have just been diagnosed with their cancer, and so they are a little bit in shock sometimes. And the first meeting can be very brief, depending on their emotional state, or if they have adjusted to their diagnosis, it can be a little more extensive. Some patients want to know a lot of information. Often they have a family member with them that's taking notes for them because they may not be ready for all of that information. Sometimes the patient is ready, though. Sometimes they come in with a lot of questions, a list of questions, and they want to know everything. It really varies. The first meeting with a speech-language pathologist will usually involve an evaluation of their baseline speech and swallowing. And some patients have no difficulty before they start their treatment, but others may have difficulty depending on the location and size of their tumor. Speech-language pathologists can evaluate swallowing in different ways. We can do a clinical evaluation where we watch people in our office and evaluate their ability to swallow liquids, soft foods, harder solids, or we can do more instrumental evaluations. We can evaluate swallowing under video fluoroscopy. That's an X-ray swallow test where we would take patients to the radiology suite and watch them swallow foods mixed with barium, and we turn on moving X-ray or video fluoroscopy to see how the foods go down and if they can swallow safely. We sometimes do a FEES exam in conjunction with an otolaryngologist or ENT. While the ENT is passing the endoscope and looking at the vocal cords or the pharynx or larynx, we can give patients something to eat and swallow and look on the endoscope to see if they're swallowing safely. I like to meet with patients before their surgery to give them an idea of what to expect and how their speech and swallowing might be affected by the surgery. And then I would see them in the hospital after their surgery to do some initial evaluations. After their discharge from the hospital, I would follow them as needed until their speech or swallowing is as good as it can be. For patients getting radiation or chemotherapy and radiation, the meetings with speech-language pathologists are similar. Ideally, we would meet with patients before their treatment begins to give them an idea of what to expect with radiation. We like to meet with radiation patients throughout their treatment as well, at least once midway through their treatment to make sure they're doing their swallowing exercises and to check in and see if their swallowing function is still good. We might also make sure they're connected with a dietitian or social worker as needed during their treatment. And then if things go well, as we hope they do, we meet with patients when their radiation is completed, and then 3 months, 6 months, and 12 months after, again, just to check in and to intervene as needed if they are having any trouble with speech or swallowing. This is a diagram of the head and neck. We teach patients a set of exercises to strengthen the base of tongue, the pharynx or throat muscles, and even the muscles of the upper esophagus. We like them to do them twice or even 3 times a day throughout radiation therapy. Most hospitals, even in rural or smaller communities, will have a speech-language pathologist who can work with patients with swallowing and communication disorders. In larger hospitals or head and neck cancer specialty hospitals, you might find a speech-language pathologist dedicated to just working with that particular disorder. Sometimes patients with head and neck cancer are referred by their primary care physicians, but more typically it comes from an otolaryngologist or a radiation oncologist. Speech-language pathologists should be both licensed and certified. We have a national certification through the American Speech, Language, and Hearing Association, or ASHA. If you look on the ASHA website, you can find a licensed certified speech-language pathologist in your area. If you or someone you love is affected by head and neck cancer, remember, you are not alone. Together, we are made of more.